Good evening, everyone present here. I am Faraz from IJCP Group. Welcome all the participants on today's live session, and that is on a very important topic, that is idiot syndrome, medico-legal risk and professional boundaries. As we know that this topic is a very much important, so we need someone who is expert. So, without any further delay, I would like to invite speaker for this webinar, none other than Professor Dr. J. A. Jayalal sir, and let me share some of the achievement of sir. Sir has done MS, MBA, DLS, FIAGS, FAMS, FICS, and FRCS from UK and PhD. And he is professor and HOD of surgery, KGMCH, and president of Commonwealth Medical Association, IMA National President 2021, and National Coordinator IMA UNESCO Chair of Bioethics, Governing Council Member Dr. MGR Medical University, Academic Directors of IMA CGR Headquarters. So without any further delay, I would like to invite sir and hand over this session to sir. Sir, the stage is yours. You can proceed from here.
Thank you. Thank you for the JCP on the Med Talks. And once again, it is my pleasure to be with you. I apologize in the last week I couldn't join, but I'm happy that we are going to talk about one of the growing problem which among the whole community. We all know that we use internet, and we all know that the usage of internet is uh, increasing day by day, and the number of people who are using internet or the medias for social media for their life is much more important. Yes, to some extent, the medias and the internet, your WhatsApp, and all are good. It gives you a lot of information, a lot of knowledge, a lot of ideas. But what is happening today, and the trust on the medical professionals are deteriorated, and the people have started more and more trust on the internet to derive informations, and whatever the internet say, they think it is a absolutely right one, and that is leading to a very very serious problem, which now the whole world has identified and understood, and we call it as now a idiot syndrome. What is this idiot syndrome? It is a very curious name, but it is nothing but the internet derived information obstruction treatment syndrome. That means the information which you are getting through the internet, not through an official learned colleague of a doctor, and either through the Google or either through the, your whatever the medias of net, and you are forming your own ideas, and you are forming your own resolutions, and saying that many times you take no do not take the advice of the particular respected doctor, and that is resulting in the obstruction in the taking the treatment, resulting in and so much of consequences and so much of problems. So the idiot is a word which stands for internet derived information obstructing or obstruction treatment syndrome, because that you are not going to take the doctor's advice in a proper way, and you are going to go to the whatever the internet is saying is right, and not doing the things, and that is going to be a disastrous and what. So this syndrome is not a fancy one which we are talking, because this is a day in and day out we are seeing in our clinical practice in the medical colleges. It was once we thought that it is only there in the people who are the higher learned people or the well developed countries, but right now it is deep down into the nook and corners of our country, the rural areas, the public health institutions, medical colleges, wherever we see the lot of questions people ask, and they get away from that. Why should I take 5 days drug, and doctor has given only this, and why should take this, and doctor may be interested in taking his self-interest, and that kind of feeling is now coming, and that is what now we are interested to talk to you today. We know that idiot is a word which is a very derogatory word probably we will use, and someone who has a less IQ, someone who cannot take things in the proper sense, and someone who cannot react to the problems or the challenges. Those we normally call it as an idiot. But this idiot terminology is little different, and they are not non-knowledgeable people. They are good at quite learned people. They have information and computer literate people. They get, but the information which they are gaining is not stopping them. So here the information you are collecting from the second-hand information from the doctor or a Google, which has been a hindrance for many times for the doctors to execute the appropriate treatment. Every drug has a complication. Every method of treatment will have some kind of complication. The internet will give all the possible complications for that particular things, and the person believes that yes, I may get into this problem, and so he come back and say that this drug will cause that kind of headache, so I do not want to take, and that is resulting in the cause versus the effect. What we say is the risk and the loss, the disastrous effect is much higher, and that is why we are very particularly now I wanted to talk to that. We know that in internet use, India is the largest, second largest. Probably the China is taking the highest. This is a figure in 2022. China had 8,050 million. Sorry, 850 million people, but India was using 503 million. If you see this, there is not much of difference between the rural and urban. Almost the rural and urban use. But if you see what is happening in 2025, we have still gone much higher. We have reached the level of the China. Now India has nearly 806 million people are using internet, and China using 1,110 people are using. So still China is in the top, but India is almost from 2022 it was 530. Now we are crossed up to 806. This is in February 2025, and by now it must be gone still further. And so the use and penetration, percolation of the internet is very high. Anybody even in the petty shops, rural areas are also able to get into the internet. So that has a tremendous effect. It was originally there is only few people who are having the information and few people who are doing that. But today, now, even if you are not properly understood the complexity of the human beings and the complexity of the diseases, the few of the inputs which that internet is giving is always creating a problem among that. And it is not only happening in Asia Pacific region. It is happening in almost throughout the globe, whether it is in Asia Pacific, Europe, Latin America, North America, and in their region, this problem of idiot syndrome is percolating because of the possible reason of using the net. India is one country where we have rapidly now changed to internet based. Our small vendors started using UPI and using internet, using WhatsApp and a lot of other media. So that is, I mean, the penetrability is very high, and this is a figure which is on the higher side. And let us not remember into this because this is so solely the large volume of the people are using that. So what is this actually happening? By this, what is happening? Almost in there is a study done in Canada. There is 1.1 million people are using, and what now they have made out is from this slide. This is I converted from Mac to this PPT. So this is some change. So almost 19%, and what they have identified, the information the people are getting on medical values and medical things are fake or not correct. So the problem is that we, as a medical community, we are all happy that the more and more information on the health is coming to the people, and we use that for chatting with the peer person, informing the person, reminding him about his next visit, and reminding him to take about the tablet, and all that parts are good. But the information and how secure the information is, how the right the information is coming is a big problem, and we are not getting. So this idiot syndrome is a one syndrome, which are the people who are more commonly, they are involved in the internet searching on their medical issues. As soon as you get a headache after the long hours of working, and if you are going to the net and trying to find out what this headache and what it could be, at the end it will say it could be one of the symptoms of the malignancy or one of the symptoms of the cancer, and you get into a problem. So that what we call it as an idiot syndrome. Most of the newspapers has talked about this. This is an article which has come in India today. Are you an idiot? Yes, it is a real condition. It talks about the people, the health diagnosis and medication information from online resources and led to the idiot syndrome. So if you are a person, if you are a your colleague or your region is what is looking onto that. And India Today has written an article, Medical Dialogue, which is one of the very famous article. Again, it talks about idiot syndrome is hampering an asthma treatment. They did a mixed study, and asthma treatment, there are areas where you use steroids, you use drugs. So internet will say that using this particular steroid for a longer time will cause to be a problem, and so the person says, no, I will not take. So the doctor is going to prescribe only after considering all those things, only if it is necessary. If he is not going to consider, it is going to become an addiction, if he is going to have the complication. When a doctor prescribing that particular drug, this is not only then a steroid, but theophylline or any particular drug, when they are giving for an asthma, and immediately the person says, no, this is a complication of that drug which I have read in the net, so I'm not using that. So that is leading to quite a lot of this. Is a big study which has come on the medical dialogue, and in multiple language, in different language, in Hindi there is in a jargon, that article called Kya Hai Idiot Syndrome. There's people have started talking about that, because this is going to be it is highly affecting the people. And Kya Hota Hai Idiot Syndrome, in each, whether in the Hindi or most of the regions now started to that. Why we are entering into this idiot syndrome is one more terminology you should about that Dunning-Kruger effect. This is one phenomena where individually we feel we are great, we are excellent, we know everything, and the internet is stimulating that, and internet is empowering that to think that I know everything about this disease, I know everything about that particular problem. And if the doctor is prescribing, and you just think that the Dunning-Kruger effect, that it is only a cognitive bias in which the people believe they are smarter and more capable than they are. Actually, they are not capable, but still they believe that they are so capable, and their low ability of the people to do not possess the skill to necessarily recognize the danger and the minor points out of which will not come, but they're only that egoistic bias that I know much better, my internet has given this information. So that Dunning-Kruger effect is one effect which we say that is leading to the effect of the people to taking that. This is a small event which this is not gone. Okay, Indian Express has written a letter, India Idiot Syndrome, a challenge to Doctors Express, because they did a study and a lot of article has come. The World Medical Saviors, it says, idiot syndrome, internet-derived information obstructing the treatment. Be wary of the Dr. Google. Hindustan Times, right? Are you suffering from idiot syndrome? Know how Googling your health condition can impact your health. And this, I have chosen this topic particularly because this is what going to be happening regularly. People have started Googling and meeting the Dr. Google University for getting the information on the medical condition, and resulting in so much of hindrance, so much of reversion, so much of the problem in the executing in normal, genuine medical care. I want to repeat it. Getting the information from Dr. Google is nothing wrong. It is, if you are just to say to update the knowledge and clarify it with the doctor and get to the confirmation, then it is fine. But because of the Dunning-Kruger effect, this knowledge is making you to think that you are knowing the superlative person, and resulting in not listening to the advice of the doctor and considering and neglecting that, and that is leading to a greater lot of problems there. Why we say that you don't believe on the Google, or you don't give much importance to the journals, articles? This is one important article, one section you need to on. There is one condition of retraction of the published article. See, when you are going for the searching for a headache, you can see hundreds of research articles which has been published, and you think that all are right, and you get an information from that. But what is actually literally happening? Now, India is one country, not only India, in most of the country, nearly 30 to 40 percentage of the articles published are retracted. Why retracted? Because there is a serious flaw in the article. There are few reasons. One is a serious flaw, unsubstantiated introduction of the data. There is a research misconduct. There is an undisclosed conflict of interest, and ethical approval is not. So various reasons. So a published article, which thousands of people have Googled and got the information, or withdrawn, as it is a false. And this is not ordinary data. If you see the amount of people which is being retracted, it's just very huge. I will just article from elsewhere, published article. This is one of the very standardized publication journal. Their article is retracted because of the false information. Application from the another article, which is internationally high impact article, that has been withdrawn. You see the countries which have a highest retraction. 30.6% of papers published in Saudi Arabia is retracted. In India, 15.2% of the papers published or retracted. The companies has taken it back because the data given in that articles are wrong. So if you are read 100 articles, 15% of your article you are read is wrong. And what you will not have an opportunity to go and see that which are the articles retracted. It is very difficult to find out. But this is happening. Even one big institution in India, especially in Tamil Nadu, one of the biggest institution, the last year, their retraction rate was 42%. They published nearly 2,000 articles. 42% of the article. But this is happening only in a high-end journals. That is a high authenticated PubMed journals. There are thousands of articles which journals which publish just for the sake of 1,500 to 2,000 rupees, and there is nobody is to bother about those articles, and there is no retraction will take place there because they are not going to check the authenticity. But there are standard authenticated PubMed, Scopus, Empus declared others. So they will go for a constant review, and they say that what you have said is wrong. So initial you are given a wrong information, so that will be retracted. So this is one of the area why we say that is the internet derived information is not going to be right. It is apparently it is always going to be a problem for the people who are there. They are called predatory journals because we say that now it is we know what is predator. It is something which is going to be killing the people like things. So these journals, for their publication, they may publish, but then the scientific bodies comes out and say that prove that this is wrong and what you have said is not appropriate and your research methodology is not right. Then they started retracting them. So this is one year where we have to problem. And this is again, see the picture of this the red line shows the number of articles getting retracted every year from the standardized journal. The black one is the number of journal being published, and but you see the red, it is also going every time. It is going high. The level of upper limit is going high. 2010, 2015, and 2013. So remember, the internet derived informations are not appropriately correct. 20 to 25% of the time they are wrong data. Just because the data has come in a journal, that is not going to be right. So that is one reason what we say. And second, now the apps. That's a journal. Now, what is the biggest app? If you say probably in India, in the rural areas, we say the WhatsApp may be the top, but ChatGPT, which is one of the most trusted body in the AI, artificial intelligence. If the worldwide, if you see the ChatGPT is the highest use area, 52 million people. 52 million people have downloaded the ChatGPT and using that. And WhatsApp, TikTok, Instagram, all that names, Telegram, Signboard, Bold, and all these are the other ways of media. One is the journal. I have proved that the journal itself, in the standard journal, in a standardized article, in a PubMed journal, 15 to 20% is wrong. And in chat GPT and WhatsApp, and it is a message is what you are getting, 50 to 56 percentage or a fake news. It is not scientifically approved. And someone somewhere it is say just forward, forward, forward. It is going on. So the whatever the message we are going to get in that, only 50 less than 50 percentage of the message on even information which you are going to make through the chat GPT, there is a flawed message are there for that 50 percentage of the people. So you need to be watch for that. And the number of people who are using and that this is WhatsApp was used much in the before the chat GPT. WhatsApp was high, but the percentage of the users are high. The information what you are going to get is also going to be high. Now there is a one India is one country where we always had a family doctor, and we are the incarnation of the family doctor concept was there. He is not only a doctor who takes care of your physical health. He will be the person who will be there to give you counseling in all aspects of the life. And in general, if you see the health, is not a mere absence of disease. The WHO defines the health as a state of complete physical, mental, social, spiritual well-being of the person. So the family doctor is one, and who knows you and who is related to your family, and every function in your house, every information in your house. And when you get a first rank, when you get a marriage, a child, and all that will be linked to the family doctor. He always knows the in and out of your family. So when you come to him with a headache, he knows that yesterday there was a fight between the husband and wife, and that could be the reason for this headache, and he give a small tablet and counseling, and you go back and you are fine. And but today slowly the family doctor is coming down, and the Dr. Google is coming into make that play. Dr. Google has no personal emotional attachment with you. It is only having a scientific information. There are 1,000 causes for each disease, 1,000 reasons for each problem. So when you go into the family doctor, the family doctor trying to analyze what is the problem, what has happened wrong, and how it is this, and what should be done, and he will give you a reason. And most of the time, and if necessary, he will refer to a higher person, and when it is necessary, absolutely. But the Dr. Google, it makes you to feel uncomfortable, because it will give you all the possible diagnosis with your headache and all the possible consequences, and always make you to suffer, believe it, and don't go to this and go to the CT scan, go through the MRI, go that, do that, and that kind of a problem, which is, so there's another conflict. The conflict is in the wrong retraction in the journal, fact messages come into the WhatsApp medias, and the third is a Google doctor with a family doctor. This is a very jokingly put picture. This is a sick patient. The family doctor is considered as a wife, and Google is considered as your lover. Towards now today, slowly the passion to look at the Google is more, and beautiful girl going past you, that you are going to look into that way, that for everything now Googling is going to taking place. It takes away the doctor from that. And with this, you are going to have another kind of physical condition, which is called cyberchondria. The same idiot syndrome, where it makes you not to take treatment, internet-derived information obstruction treatment, that is leading to an individual called cyberchondria. That means you get into the Google, study that, and you feel that you are suffering from this disease. You have this headache, it could be a cancer. It could, I may have my stomach is that problem. It could be the malignancy it is coming out that. And this is one of the big problem called cyberchondria. And person who get a disease per se, feeling that there is. The idiot syndrome is he has a disease, but he is not taking treatment and getting into problem. This is a normal individual with the internet-based information. he stopped taking the advice of the doctor. He is going on his own and resulting in his disease called cyberchondriac, and so much kind of. There is a study says the 4 out of 5 internet users look online for health info many times, and commonest cause while you are looking into the internet is health info. So that is resulting in your predisposing factor. It can trigger your predisposing factor. It affects your personality trait. It makes you worry about illness. It create an intolerance in you about the uncertainty whether it is there. It believes in letting you to believe, and you say that nothing, medicine cannot cure. So I will go into some of the rituals, some of the religious fanaticism, some of the things. So all this cyberchondriac is creating a problem. There are a lot of causes for this cyberchondriac. It could be even a minor trauma. It could be a major social problem, a loss in the family, unexpected problems happening in the house. All that can lead to the cyberchondriac. So the 4 causes, what causes cyberchondriac: the negativity bias which we are having, the stories which we hear, free misinformation, living in a more stressful world. Now that is true for all of us, and most of us lives in a stressful conditions. We do not know what to do tomorrow, and then the prices are rising, the job is not guaranteed, the traffic is high, and it is a stressful life. And when you are stressed out, you have family has some issue, nobody is there to counsel with you, and you always have a negativity feeling, that is this is not good, and I am always an unlucky fellow, something will happen to me always in an unlucky way. So those are the people who get into the cyberchondriac more problem. So what are the symptoms, and whether you are an idiot syndrome or a cyberchondriac, is there is anything which you have a problem? If you are going to the Google for every small symptom which you are getting, and you are not happy with seeing Google, then you go to Yahoo, you go to the Medscape, you go to the other media. So multiple media you are going to see, and you are searching for information which is making you worse and worse to that. And the more search, and at the end you are convicted that yes, I am going to die, and and that you then develop a pity on you and develop an anger on other people. Then you think that disease is incontrollable and it cannot be there. I don't have a money to spend. There is so much of investigation available. A positron gamma camera is there. It costs 15 lakhs. So that is better for surgery, but I cannot do. But remember, there are 50 rupees tablet, there are 5 lakhs cost. A family physician can tell you, maybe this 5 rupees tablet can solve your problem. And the internet will never tell you. Internet will only show you that a top level of that. So that is are the areas where you get. And there is another word now comes, infodemic. You should have heard the word pandemic, epidemic. Corona is a pandemic. Cholera, malaria is coming as an epidemic disease. Now WHO calls one term called infodemic, which has created both in Corona time and COVID time, and we had the false information spreading more than the virus. The virus can spread, it takes some time to spread from one person to other. But the information, the false informations are spreading like a field fire. And the infodemic is the problem now. It is not that lack of information, but the most of the time that we are living in an infodemic, which has jeopardized our knowledge. Disinformation, it is not a proper way of information. Fake news and information. The fake news has, nobody has any liability for fake news. Most of the time, the fake news comes in the WhatsApp, face, and now unless for every news you are going to check it with a fact check, and you are going to lose. And all the informations are going to come with the health. And if you say your results, suddenly they will say you are HIV positive, even your cancer cells, this is positive results, and that data, the misinformations are going to come on in a big way. So the contributions in the digital era everyone has an access to the smartphone, laptop, and increase in the rates of internet-derived obstructive syndrome is resulting in this, as a result of that when the internet-derived information obstructive treatment syndrome occurs, when patients abruptly quit their treatment because they have blindly trusted the internet than the medical information. We have seen many people. We can show a few examples. You go to keto diet. People say keto diet, you need not take a diabetic tablet. And we have seen hundreds of people where they were not able to take the proper keto diet, getting into the problem of the diabetes, and a very aggressive stand they are coming. And people who have renal failure go to the quack, taking the tablets which they give, steroids, which gives them apparently some help, and coming down late with a worsening of that situation. And this kind of infodemic, which is resulting in a big problem. So patients get important health information online and anticipate an additional assistance. Doctors are becoming sick because of stress, and they need to take care of their health. Now today, the whole bent up problem is not on the patient alone. But the patient comes to me to see me, and always he comes with a Google report and Google data. So he always comes with a second opinion, and he always comes with the frustrating questions. And that again leads on to stress on the life of the doctors. So what are the signs of this idiot syndrome? We call it the EMATs. There is a five, that we have the features, the five symptoms. It is called EMATs. E, excessive time spent online looking for information. If your colleague, your son, daughter, or your parents, if they are going to spend, I told you in the beginning, the people who are spending time in the net, 4 out of 5 is for a health information. So if there is an excessive time spent on looking for information, that's the first symptom of an idiot syndrome. And mistrust of medical person whose help can be sought in person. That is the next M, EMETS. Then M, they will not go to a doctor and directly discuss with him, and this is what I learned, and it can be used or not, because they don't have a trust on the doctor, and they will talk badly about the doctor. Doctors are money minded, doctors are earning, doctors are doing wrong things. And all those people who are talking such a bad words against the doctors, they are under the idiot syndrome. They have suffering. And the third is called A. That is an undeserved and compulsive search for knowledge. Again and again, they will go to after the internet, they will go to the journal, they will go to the WhatsApp, they will go to the books, they will go to somebody who is a quack and already having this experience. They will go and talk about that. And D, always they will in a distress brought about by such behavior. They'll have an anxiety, and there will be always a tension. They will not think as a positive. See, always in the mind, and unless you say that this disease is going to cure for me, and you are going to end up in the problem. So that is there. And yes, looking for an assurance from reliable sources, which they are not going to get. So the EMETs is the normal way of the symptom. The excessive time spent, mistrust, undecided compulsive search for the knowledge, and the distress brought on by the search behavior, and looking for assurance. These are the EMETs is there. And how we are going to treat them? This is a big problem now. And this, unless the doctor also going to play a role, he has to understand, diagnose the person is an idiot, and talk with him politely, make him understand, give with example, explain to him, and enable him to come to a proper conclusion. And then only the possibility of there is a lot of theories. I don't want to talk into that. Lot of strategy how to manage hypochondriac medical people, and that. So this is, and if you are an idiot in syndrome, if you are having a cyberchondriac, what you can do? There are 6 steps. Let's remember these 6 steps, and avoid self-shaming. This is what many times you do. You say that you disease, and you say, I am useless, I have got a disease, I am going to die, and nothing is going to work in my favor. And that kind of attitude should go. And be compassionate to yourself. I always used to take love yourself. more than anything in the world, that you need to love yourself. You need to accept yourself. You need to, even if you have a disease, that you need to accept yourself. That is what the God has given to you. And that, be compassionate, never fight bad words against you. Don't use, unless you are a useless guy, I should not have born, I should have died. Like that words, never use. And third, you must use some relaxation technique. Go to some ground. If possible, you are a young, go and play, or go to a movie. Just involve in that. If you are a musical instrument player, play that instrument. Whatever it is your hobby, try to do that. If you know some hands arts, and try to do that. And you must have the ability to challenge your thought. That somebody says that you are going to die, and you must be able to say that no, I have an ability to live. And most importantly, talk to your doctor. Go and talk to him. Doctor, I am getting such kind of feelings, I am such content of, I have stopped this medicine which you have prescribed. I feel ashamed of myself, and now I understood the situation. And try to always see the bigger pictures, and definitely you will be then. This is the cyberchondriac people, how they work. That is what I told. Avoid self-shaming, be empathetic to yourself, practice relaxation technique, challenge your thoughts about being ill, consult with the physician, and realize the bigger way. Then definitely you will be able to go. There's a different scales of cyberchondriac. Again, I am not going to do that. You must remember there's one more syndrome, which is Savant syndrome. I'm not going to talk with that. Savant syndrome is a different from idiot syndrome. Savant syndrome is it is one of the spectrum of autism, where somebody will have extraordinary talent in one particular field, and that is called Savant syndrome. But that is not. But never ever confuse yourself with the goal. So now, most of the time, people do not come to your doctor without visiting the Google, and that should be always changed. And you must come to the doctor with a good mind. If you go to the Google and ask, "Can I cure this cold with the whiskey?" the Google may say yes, because Google try to see, because it analyze the problems, and it is going to give the problem. And there are a lot of incidents we have seen. We have known the people going with a small problem, ending up in a major problem. So this is something equivalent to, there is another syndrome called medical student syndrome. This is also something like this, but they don't the medical students. It is a feeling of a medical student when we are studying our first year or second year, third year. Whatever disease we learn, and as if we will feel that those diseases we are having, because most of the time the disease will start nausea, vomiting, headache, pain, abdomen. All this will be the common for the most of the diseases. So medical student syndrome is little different. This is different from idiot syndrome, where it says the student feels that I am having that disease. This headache, they say if you have a headache, a normal person may think that it is I didn't slept well yesterday, but medical student would have read about intracranial hematoma on that day, and he will immediately feel, oh, this headache is due to intracranial hematoma. And there are many conditions, we say syphilis, diseases. So that medical student syndrome is something similar to that, but different. Most of the common problems we see in the medical students is hepatitis C, the squint, angina pectoris. I have pain in my left arm since 2 weeks. So immediately you think it could be an angina, but it could be nothing. So this is a similar pattern like an idiot syndrome, where you are going to see that, and you are going to change your thing. I am not going to the medical students is okay. So how to deal with idiot syndrome? We have already talked with that. Avoid the self-shaming, practice relaxation, challenge the negative thought, and consult a doctor. And if you can come out to that, to consult a doctor. So finally, I will talk about another 5 minutes for the few things, just for your check. Do you search the internet for information on medicine your physician has prescribed? Please remember, note, your physician has prescribed a medicine. Do you search the internet for information on that medicine? Do you search for diagnosis of your symptoms on internet than with a doctor? Do you self-medicate yourself by doing Google? Do you search on internet for side effects, contraindication, and drug interaction of the treatment prescribed by your doctor? Do you stop the treatment after reading such information on internet without consulting your physician? You are exactly under idiot syndrome. You search for the complication of the drug and stop the drug without informing the doctor, and that is what you are going to do. So what it results in, it is a decrease in the patient trust on the doctor. It is a partial knowledge about any medical condition. Is drug is always a harmful, leads to non-required investigations and procedures, unacceptance of the treatment by the patient, and complication due to the interruption of the supply. So that is a complication which we are saying. So you can refer, but remember, referring the internet for information is not wrong. You can refer the internet for your knowledge, but not for self-diagnosis. You can trust only trusted website, PubMed, journals. Always take your physician opinion before taking or stopping any medication. Trust your physician, take treatment as suggested. If you feel you are experienced on the side effect, immediately consult the physician. He will help you, he will be enable you to come out of that. So let us remove the positive effect on the medical profession, doctors, and trusting on the internet effect, and then definitely wear that. There's one term called artificial stupidity. This, we talk about artificial intelligence, but artificial intelligence is not always artificial intelligence. It can lead to artificial stupidity. There was one condition which was explained, and Mr. X was going to Washington and on Monday morning, and he was searching the Google for the what is the climate there, what kind of dress I should take, and will it there be any rain in that, what is the temperature. He supposed I will land there by 10 o'clock. So it gave a lot of information, and it is a sunny, hot day, so you need not take any dress, and it is only not going to rain. But what happened on the way, he missed his flight. Instead of landing up there on the morning, he had to land up in the evening. By the time the climate has changed, there was a torrential rain, and he has to get into that. So artificial intelligence is like that. It can give you the data exactly at that. It cannot take into the surrounding circumstances, to the situation, which can lead you into an exactly opposite effect. So that we call it as an artificial stupidity. The idiot syndrome is also one of the features of the artificial stupidity in which we are talking about that. The finally, and internet-based crime. People, they know, they read the internet, they get into that and try to do the surgeries, deliveries on them own. A 34-year-old man who tried to help his wife deliver at home with the help of the YouTube video in Ranipet near India was arrested because the mother died with a proper bleeding. An unmarried woman tried to giving birth watching the YouTube, resulted in profuse bleeding and died. A Bangalore man, it was a shocking, UP, the Madura man attempts self-surgery after watching YouTube video. He landed in the hospital with a much complication. The Bangalore couple demanded to do surgery on son after watching YouTube video, and there was complication. The infant dies as the man tries to carry out wife's delivery at home using YouTube video. I'm just saying that the internet derived information is not only affecting the particular person's management, it also affecting his family, his wife, children, and they are all affected. Friends, in conclusion, the idiot syndrome, there's a growing demand for public education on what, where, and how to look up diagnosis and cure online. The expectation of patients and their caregivers has grown as a result of these rapid advancements of the technology. When patients rush to the hospital with inflated expectation of the medical staff, the doctors are overburdened. The demand for doctors and nurses to work non-stop is getting worse every day. Given the burden on doctors, they need to take care of their own health, and many have had challenges with their health and are getting sick due to stress. There is a greater lack of trained workers because many people have become unwell and have not returned to work. Don't fall victim to the idiot syndrome is our request to people. And internet is good. Internet is social media is good. Getting reading of books or knowledge is good, but always, and remember, a MBBS doctor has spent 5 years to get into that degree, another 3 years to get his master degree, probably another 3 years to get his MCH degree, and probably another 10 years to become a consultant level. So that kind of knowledge can never match with a knowledge which you are going to get with the internet. And the internet derived information blocking your treatment schedule, stopping you to take tablet is a crime you are doing to yourself or your family. If you have doubt, discuss with the doctor, but never do it without so. So thank you very much for this opportunity to talk to you. This is one of the rare common phenomena which is happening, but the knowledge on that is not spread much to the people. That's the reason why I have chosen this topic to talk to you, because we see lot of people, lot of youngsters, lot of learned colleagues, especially in the IT field, are getting into the problems using unwanted tablets for their pregnancy, and ending up in the very disastrous consequences of that. So let us use internet for a good purpose, not to become cyberchondriac or not to become idiots in our life. Let us be wise and knowledgeable in whatever we do in our life to you. So thank you very much, and I will be happy to get some questions from you. And I hope I have stimulated you to think on that. Go read and more on that idiot syndrome, that you will get to know much more things then.
Thank you so much, sir, for taking out your important time and sharing your knowledge on this topic, sir. I definitely think this session knowledge is going to help all the participants on their practice, sir. It was very practical presentation from your end. I hope it will be very much helpful to all the participant doctors who have joined this session, sir. As this topic has discussed very practical way, I hope much needed topic you have covered, sir, and wonderful presentation. Sir, we have received some questions, sir. With all your permission, shall we take these questions one by one?
Yes, please.
Yes, sir. First question is Dr. Subramaniam is asking, how do you differentiate between an informed patient and one affected by idiot syndrome, sir?
Yeah, informed patient is one who will take the tablet, continue the medication, continue the treatment. But idiot syndrome is one where he is not going to continue your treatment. He will come discuss with you, but he is going to throw away the tablet which you are going to give, and he will go either stop the treatment or he will start something else. So that's what we say. So internet derived information obstructing the treatment schedule of you, then only they will be called as idiot. If he is coming and asking some Google question and getting clarified and taking treatment, they are absolutely fine.
Thank you so much, sir, for sharing your expertise on that question, sir. Moving forward, we have another question from Dr. Agnuhetri. He's asking, sir, in your experience, in your day-to-day practical experience, has online misinformation significantly impacted clinical outcomes, sir?
Online.
Sir, the question is, let me repeat, sir. Online misinformation, sir, is
100
significantly impacted clinical outcomes.
100%. I have seen hundreds of patients, especially young mental health people. What we are now seeing, mental health issues which we are facing. The most of the time, the issues are with the problem. And we have seen with a lot of people who are coming with the infertile couple. If you see the behaviors, we have the why they are not getting. There are small informations which says that, and if your period is 2.5 days, there's one article has come. It depends upon your the menstrual cycle time. You can sure you will get a pregnant or not, and that absolutely that is wrong, because we need just only one sperm is necessary to the getting. So but that is getting into their mind, and they negative themselves and going away. And this, and many times we get even surgical conditions when the person comes with a surgical condition, which we have an ureteric stone or a gallbladder calculi, they come and they have read in some internet, or some of the sages what we have in our countries, where they say you do meditate like this and everything will be solved, and they believe on that, and they stop the treatment of the doctors. So that is it is, I have seen many cases. That is why I have chosen this topic to talk to the people today.
Thank you so much, sir. I hope that Dr. Agnihotri has got his answer, sir. Very practically explained, sir. I can see one feedback from Dr. Subramaniam. He is telling, thanks for answering my question and wonderful topic. Thanks for covering it.
Thank you.
Welcome, sir. Sir, one last question I can see, sir. When should a doctor consider discontinuing care due to repeated challenges from a patient quoting non-scientific sources, sir?
No, when you are asking the when the doctor should discontinue the treatment, or
Yes, sir. The question is, sir,
can you
when
repeat
should
the
a
question?
doctor consider discontinuing care due to repeated challenges from a patient quoting non-scientific sources?
The discontinuation of the care is from the two sides, and I mean, we as a doctors, because we are called to serve the people, so we don't have the right to discontinue the treatment for him unless we then we should properly hand over the person to another doctor. Then only we can come out of that patient. Till then, it is our responsibility to advise, make it viable. Even in the case sheet, that you need to make it right that this is advice given by doctor. The patient is not willing to follow. So such kind of wordings should be there. But patients are not taking the treatment without our knowledge, and if when he comes for the second visit, and that should be noted down in that. That is because I have not touched the medical legal aspect, because now not much of medical legal aspect has now come in into the pure on idiot syndrome. But in the future, it is going to bound to come, and patient is going to say the doctor has not explained this to me, doctor has not told this to me. So you need to make sure whenever you are prescribing the tablet or the drug also, you need to say that is it can have some kind of problem, like what we all of us know, metronidazole tablet we give, there will be metallic taste will be in the mouth, and if we can say in advance to them there will be a metallic taste, and then definitely they will not get into the trap. So whenever we do the surgery, when you are explaining all the possible complications, in at least in the major way, that can help. So on our part, we need to little more time we need to spend the people, little more time we need to take to explain to the people that what is that actually. And if they are good enough, and if they are not gone into the savant syndrome or something like that, they think that they are super intelligent, and they will, most of the time they will listen to that. But unfortunately, when they
Yes, sir.
think that they are super intelligent, they will not listen to us.
Thank you so much, sir, for answering this question as well, sir. I hope, sir, it will be going to help all the participants, sir. I think you are the best person for this topic, sir. The way you have explained this topic has done great, like in the form of healthcare awareness. Like good knowledge should be shared among the participant from health professional like you, sir. Sir, as there is no more questions, sir, with all your permission, shall we conclude this session for today?
Please go ahead. Thank you.
Welcome, sir. And sir, we would like to see you in future also with different topics, sir, and associated with Med Talks. Till then, take care of yourself. It was great honor to host you, sir. Thank you so much for joining.
Thank you. Thank you. Convey my greetings to the JCP and the MedTalks
Yes,
team.
sir.
Okay.
Take care, sir. Have a great
Thank
day.
you.